I have to say, I'm a fan of these Zoom meetings, especially the later evening ones, because while I'm wearing my professional dress on top, I'm wearing my fuzzy slippers on my feet. So it's a comfortable way to give a little talk tonight. So I am here, I'm just gonna X out of the poll on my screen. So the National Aging in Place Council was founded on the belief that most older Americans want to remain in their homes for as long as they can, but they may lack the awareness or the resources that are available to them. So that's where we come in. We are a senior support network of various professionals who are experts in things like healthcare, financial services, elder law and estate planning, design and home remodeling, among a whole host of other disciplines. Gina Knight and I were one of the founding members of the Chicagoland chapter. There are chapters throughout the United States, and I am continually astonished at the amount of resources that are available to families, not only to seniors, but to their support. So men and women who are in their 30s and 40s who are looking forward to making sure that mom and dad are taken care of in the future as they want to age in place. So why is this important? So this is a really interesting slide here. So this is a 2018 AARP study, which shows what you've been hearing in the news, which is that there is a senior or a silver tsunami coming. And what you can see here on this slide is that by 2035, which really isn't that long off in the future, there's going to be more people over the age of 65 than under the age of 18. And you can see on this graph as the red line, which represents children under 18, crosses the blue line, which is adults 65 and older. So you can see that at that point is really when it starts crossing, and so there's more adults. And why is that important? It's important because typically up to this point, children have been able to be the primary caregivers. There's been enough kids to take care of their aging parents. And you can see by this graph, which is now an old, outdated graph, that's going to be a big problem. There's just not going to be enough people to take care of that many adults. And so what do we need to do for that? We need to plan. And that's where we come in with the National Aging in Place Council. So Gina, if you can go to the next slide. So what is aging in place? So aging in place is a term that we use to describe people who are living in the home of their choice for as long as they desire. So to me, it means someone is making a conscious decision to stay in their home for as long as they can or are able to, with all the comforts that are important to them. For my parents, as they age, my parents are baby boomers, and they're fortunately of good health right now. But one of the things that they did is they decided to sell their childhood home and move into a house. This was probably about 10 years ago. They moved into a house that they could see, you know, if one of them were in a wheelchair, it would be more accommodating for that. It was all one level, so they were really thinking ahead of it. And so we have, as a family, have started to make decisions and think, okay, well, you know, how can we make modifications or accommodations to this house so that mom and dad could stay where they're comfortable and where they a place where they know and are familiar with for as long as they can. Now, the second definition says that really aging in place encompasses the ability to assess any service or support system within the home as the mobility and needs change of that homeowner. So aging in place isn't going to stop the aging process, of course. It's not going to fix things like your health, but it can make you more comfortable, and it can certainly improve your overall well-being and your mental health. But it can only address those problems that have already been planned for. So again, it's all about planning. And so that's where Gina and Rick and I come in. And so hopefully at the end of this presentation, you'll have some ideas for you to take to your loved ones and to discuss amongst your friends and family as far as what you can do to make that transition as safe as possible. So as I said, we're here to help you meet those challenges and to help you plan ahead. We don't want you to just age in place. We want you to age in place well. And with that, I'm going to turn it over to Gina Knight, who's going to tell you how you can do that.
Thank you, Stephanie. Welcome, everyone. We talk about what the National Aging in Place Council is, and although the original focus for NAIPC was for older adults to age in their home, the reality is that's not always the best decision, especially if a crisis takes place, and it might not be the decision for you. You might be more comfortable moving to a senior living community simply by choice. Has nothing to do with necessarily a crisis or a health situation. It might just be what's most comfortable for you. So we want to let you know that we are still here to help you. And the reason we're here to help you is we have a whole group of professionals that our backgrounds are here to help seniors along their journey, whatever that might be. So we have a full group of people, and at the end of the presentation, I'm going to also give you kind of a list of the different professionals that we have that we're very proud to have in our group here at the Chicagoland chapter. So let's get started. So to get started with transitioning to senior living, remember, this requires a plan. There's a lot going on. You're in your home. You may have been in your home for the last 40, 50 years, whatever that might be. So we want to talk about 4 main steps to plan for this transition. So getting started, I personally refer to as tidying up. So that's something that's very important because that's going to be part of the process on how we're going to get there. The second thing we're going to talk about is how do we select that best community and who's going to be able to help you make that selection. Thirdly, how do I physically move? So what is a senior move manager? And lastly, what happens to my estate? Now, I don't want you to look like this. I know it sometimes feels like this. It's very overwhelming, but I want you to not worry about it because this is why we're here to help you and get you through this process. So as I mentioned, one of the first things is tidying up. So whether you're planning to transition to a senior living community today, not literally today, but in the very near future, or in years to come, one of the first steps that you have to take is that whole tidy up process. You know, we often are creatures of habit, so we keep all these things from our kids. I know I have a gazillion things from my son, and I don't know why I have them. And I'm sure you've gone through the same exact thing. You look around and go, what is all this stuff? Well, a big part of starting is making sure that we start getting rid of things, donations, and some of it's just disposal, is things that's no good anymore or has no value. We all have these scary basements and closets that we just feel if we keep closing the door, no one will see them and no one will find them. But I just want you to know that it just takes time and it takes effort. And most important, there's a professional, trusted team that can help you through this process. So some of our basements might look like this picture on the left, and that might be you in front of the door saying, oh my God, do not open this door. So I'm going to read some things from an article that is a great article. It's called No Thanks, Mom. And these are all the things that your children do not want from you. You think they want them. So it's a great article. Nobody's trying to hurt anybody's feelings, but we want to make you aware of the fact that, you know, I tell my own mom, my dad's turning 80 this week, and they've got more stuff in their home that they think I want. And I don't want it either because I live a very different life. And then the younger generation, so my son's in his 20s, someone of his generation, he's going to live even more minimal than I live. So here's the top 10 things that your children or your grandchildren do not want. Number 10, books. Hard to even donate them to bookstores anymore. And especially with COVID, the donation centers are so overwhelmed because people have taken the advantage of some of the time to clear out their homes. And now there's like an overabundance of things. Number 9, paper collectibles. So things like family snapshots or old greeting cards. Number 8, sewing machines and film projectors. They were good in their day, but they don't have any value anymore, and nobody is looking to purchase them, and nobody has room for them. Number 7, porcelain figurine collections and cabinet plates. So that collection of frogs that you have, or the horses or the Hummels or the precious moments, for instance. I get client after client who's telling me they have these things and want to know how valuable they are. And the sad truth is they're really not, and your family doesn't want them because they don't have a place for them either. Think about it. You might have this display china cabinet, but your children may not have those, and your grandchildren, they're definitely not going to have those because they live in a different, very different world. Number 6, silver plated objects. So things like meat platters, casserole dishes, tea sets. I just cleaned a tea set a few weeks ago. I'm telling you, I don't understand why anybody had these back in the day. I remember my mother polishing a tea set, and it's a lot of work. Now, if you have a piece from Tiffany's, that's a totally different situation. That's something that would have some value. But a lot of these plated silver pieces are just not, people are not looking for them. If you go to a Goodwill store today, you can find them for $1, and there's stacks of them. Number 5, dark antique furniture. So unless it's a mid-century modern, there's a good chance you will actually pay somebody to remove it from your home. So again, think about these things. Number 4, Persian rugs. Number 3, linens. If you tried to give your daughter or a niece a hand embroidered pillowcase or napkin, they probably don't even own an iron. So they would look at you like, what am I going to do with this? They're certainly not going to pay to bring it to a dry cleaner. And it's just something that they just can't even relate to. It's a different generational thing. Number 2, sterling silver flatware. Again, a lot of us had them. My mom has a set. She still brings it out at the holidays. But is it something that I want to inherit? Probably not. And the number 1 thing is fine porcelain dinnerware. So your grown children and grandchildren, they have smaller homes. So they don't necessarily have a place to put all these extra plates and things of that nature. So that's the sad news. I'm sorry. So let's talk about the elements of tidying up. So we like to work things where we do 4 different categories. So keep, that would be things that you're going to have a value, or they might be a precious family heirloom, or items that just have sentimental value. And those are the things that are going to go with you at some point should you relocate to a senior living community. Now, keep in mind, those items that are keep, they can't be a large amount because you're going to be downsizing. You're going to be moving into a smaller space than you currently have. My next category that I work with families is donate. So let's think about, you could have 8 Afghans in your home, but the reality is you continue to use the same one over and over. So think about donating some of those to, homeless shelters or to churches, any other things that you might have that you have an abundance of. It could be coats. How many coats do we need? Once you move to a senior community, you're going to need 1 for each season. You're not going to need an abundance. So this is a good time to do those things. As far as furniture pieces, when you're going to donate, there's some wonderful charities out there. Clearbrook, they work with families that have disabled members. There's Habitat of Humanity. Your church or synagogue might have a program. There's homeless shelters, as I mentioned. There's AMVETS, Salvation Army, all those different places that will definitely be happy to take some donations. A sell category. So you're going to be looking at what are those items that have value. So it could be some antiques that have some value. It could be some oil paintings that might have some value. Those are the things that it might make some sense to work with somebody who can do those selling things for you. I will caution you that I don't think it's a smart thing for older adults to be trying to do things on the Facebook marketplace and things, because you're inviting somebody that you don't know to your home. And for safety reasons, I don't think that's the smartest approach. Now, if you have somebody who can help you with with these things, that's completely different. And then the fourth category that I break things down to is pass on or share. So that would be like if you want to pass on something to a family member. So you might have like this amazing crystal bowl that's sitting in the middle of your dining room table that you know in your mind you would like that to go to your granddaughter. I invite you to think about gifting that to your granddaughter today. And the reason I say that is, wouldn't it be wonderful for you to have the joy of giving it to your granddaughter, knowing it went exactly where you wanted it, and see the joy and feel the joy of that, versus just having it that, oh, you tell your son, well, when I pass away, I want to make sure that, my granddaughter gets this crystal bowl. Pass it on to her now. Enjoy that moment, and I want you to get joy of doing those things. And same thing if it's something you're going to share with, let's say, a neighbor, for instance. Start looking at those things now, because again, what we're trying to do is downsize and not get overwhelmed by having to do it all at the 11th hour. Let's start looking at those things now so that you're prepared when it's time to make that decision to move to a senior living community. So that's how we get started with the tidy up process. And at this time, I'd like to introduce Rick Graffagna with Senior Solutions, and he's going to tell you a little bit more about how to make that selection for a senior community.
Thanks a lot, Gina. Hi, everybody. Again, my name is Rick Graffagna, and I've been helping families for over 9 years, and not only running my business, but also trying to stay active in the industry itself. So I've been very active on different boards, in terms of different networking groups that service our industry. So next. Oh, there I am.
Oh, boy.
All that stuff.
There we go.
There we go. So this first graph is called the Senior Living Spectrum. And the vertical bar on the left is cost from low to high. And the horizontal bar on the bottom starts with the least amount of care and supervision that somebody might need, and moving to the right, more and more until you get to the most supervision and care that someone might require. And each of these circles kind of represents different aspects of senior housing, which we're going to talk a little bit more about in a little bit further in this presentation. And you'll notice there's some overlaps, right? Because in life, things don't necessarily move, smoothly. And sometimes there's some overlap in terms of the type of help that you need and the costs that are associated with it. So if you look at the lower left-hand corner, we have adult daycare, and then you have senior apartments. And then as you migrate to the right and across, you have independent living and a little bit more care and costs associated with assisted living. And once you get to the far right, upper right-hand corner, you have nursing home or skilled nursing, which provides the highest level of care. And unfortunately, if you're paying out of pocket for privately, you have the highest amount of costs associated with that, which is what you would expect. Next slide. So now I'd like to take a little bit of time and help define the different levels and types of senior housing options that are out there. Boy, don't we wish that picture on the left was happening right now, huh? Anyway, I digress. So first of all, independent living. As you might expect, independent living is for those seniors that are independent. They don't really need have any need for personal care support. They can kind of come and go as they want. They're still driving. They may still be working. They still have great mobility. They can manage themselves very well. So independent living, or an apartment, an independent living community, could be a studio, could be 1 bedroom, could be a 2 bedroom. Comes unfurnished, so the resident provides their own furnishings for that property to make it feel, kind of go back to what Gina was talking about, right? The downsizing process. You're gonna reduce your goods to the quantity and the type that are going to fit into this apartment. Comes with a full kitchen. your basic rent gets you your apartment, utilities, housekeeping, and maintenance. There's a meal plan for you, but typically is not 3 meals a day. Might be breakfast and might be an evening dinner, but you have that kitchen in order to supplement whatever meals are not provided for you by the community. And the meals are typically served restaurant style in the property. And quite honestly, the food in senior housing is actually pretty darn good. There's other amenities available. There's exercise rooms. There's movie theaters in some cases. There's transportation. They can get you either to outings and events, also to medical appointments. There are staff on hand to take care of any needs that you might have. So that's independent living. I'm going to add another item here real quick. It's called independent living with services. So I don't know how many of you are familiar with the term activities of daily living, or ADLs. Those are things like bathing and dressing and grooming and mobility assistance and transfer help and medication reminders, things that today you might not need any help or support with, but as life moves on and changes for you, you may need a little bit of help. So independent living with services, this is really an opportunity to bring either a caregiver in that you've hired yourself, or a caregiver that's provided for you by the community that you work in, to help with one of your ADLs. So let's say you had a slip and a fall and you injured your shoulder, and that now you're not able to get dressed and undressed very easily. So you may need to have somebody in the morning to come in to help you get dressed, someone at the end of the day to help you get ready for bed. Let's say for whatever reason you've got some balance issues, and now you're starting to have a little bit of uncomfort and not confident stepping into and out of the shower. So maybe you want to have somebody coming, 3 days a week to assist with you with that shower process. Independent living with services, pretty much as long as the help that you need can be scheduled ahead of time, can make you still appropriate to live in that independent living apartment. So things like bathing and showering and dressing, and maybe transportation, mobility help to get from your apartment to a dining room or to activities. Those are all potentially schedulable events. Once the events and the help that you need can no longer be scheduled, and you really need support 24/7, or you're never quite sure when you're going to be hitting that button to call for help, that's really the time when you need to start thinking about transitioning to assisted living, which is the next level that we're talking about. So an assisted living apartment, very good chance it's in the same community that you are living in your independent living apartment. Could be a different wing of the building, could be a floor, could be in some cases a separate building. But your assisted living apartment could be a studio, could be a 1-bedroom, typically is unfurnished like your IL apartment. Instead of a full kitchen, it comes with a kitchenette. So there's cabinets and countertops and a refrigerator and a microwave and a sink. And the reason that you have a kitchenette is because with assisted living, that base rent gets you 3 meals a day. So you don't need that full kitchen available in order to supplement the dining room offerings. And like independent living, that base rent gets you, housekeeping and maintenance and utilities and Wi-Fi. It also gets you laundry done. Typically in independent living, the residents are doing their own laundry, either in a washer dryer that's in their apartment or one that's readily available on the same floor. So that basic rent gets you your apartment. In assisted living, there's a second bucket, if you will, of cost, and that's the cost of care. And that is usually when somebody first moves in, the result of an initial assessment that's done by a nurse. They're going to capture some of your medical history, your medication list, going to get a physician statement completed from you, and either virtually or face-to-face going to do an assessment to kind of determine what all are the things that you need help with. Going back to those activities of daily living, what's the totality of ADL support that you need in order to get through the day safely? So the care plan that gets put together for you could be very different than the care plan that's done for someone that's right across the hall or right next to you to your apartment. That's because it's personalized. Okay. And so essentially these communities get there in different ways. They may have a point system or they may have levels of care, but essentially it means, how much time do their caregivers need to be with you in order to keep you safe. So in addition to the caregivers, there are nurses in the building, typically up to 10 to 12 hours, if not 24/7. The nurses typically manage the caregiver group, and they also help manage any medication help that you need. There are physicians that visit the properties. So if you want to use them as your personal physician, you can. They're gerontologists, audiologists, podiatrists, in some cases, dentists that make visits into assisted living. And that base rent and the cost of care also includes activities and programming that you can attend and participate in if you'd like. So another type of care is memory care. Okay, so memory care, again, could be in the same community that we're speaking to, could be a floor, could be a wing that's devoted to memory care. There are also standalone memory care options and providers out there. So memory care is typically a secured environment because a lot of times people that have dementia and have cognitive shortfalls maybe wander risks or have exit seeking tendencies. So you want to keep them in a secure. It's not like a lockdown and feels like you're in prison, but but it does inhibit people from being able to either enter or exit that memory care. One of the biggest distinctions between assisted living and memory care is one, most of the apartments are studios. Two, the employees and the caregivers that work in memory care have been trained specifically to work with people that have dementia. They know how to manage and work with behaviors. They're really fabulous. Another big difference is in the programming. The activities and the programming that are available in memory care are really designed for those people with cognitive deficits so that they can feel like they're accomplishing something and that they can readily participate. And so they're usually in smaller groups and not as complex in terms of the activities that may be made available in an assisted living community. Next is skilled nursing. Skilled nursing is a higher level of care than what you find in assisted living or memory care. Typically, people are in skilled nursing for a couple of reasons. One, it might be short-term rehabilitation. Someone had a slip and fall, they broke their hip, they had surgery, they spent 3 midnights in a hospital, and now they went to skilled nursing rehab in order to become a little bit more functional before they go back to their home, whether it's their domestic dwelling or they've transitioned to senior housing to go back to their senior housing apartment. Another reason that someone might be in skilled nursing is that the level of care that they need, falls outside the bounds of what assisted living and memory care can offer. So if someone is on has a high level of a wound, they're on a feeding tube, a ventilator, a respirator. For those reasons, someone would need to be in skilled nursing. The third reason that someone might be in skilled nursing would be for long-term, and that it might due to financial reasons. Someone can have the higher level of need beyond assisted living, and if you can afford it, you can pay privately and stay in skilled nursing. But there are other people who, because of financial circumstances, cannot afford the private pay of assisted living or memory care and need to transition and apply for Medicaid. And for that reason, they're going to be in skilled nursing, living there. That's their new home. They got the care that they need, and Medicaid allows them to stay there. The next property is what they call a CCRC, or a continuing care retirement community. So continuing care retirement communities really are properties that have independent living, assisted living, memory care, and skilled nursing all on the same campus. The financial aspects of senior housing are a little different. Many properties are what I call rental, where there's a very small upfront fee in order to gain access. It might be $2, $3, $4,000, and it's really month to month, so that you can give a 30-day notice and you can leave the property and no longer be financially responsible. A CCRC is a little different. CCRCs have a pretty significant upfront amount that's going to be required. Some six-figure level. It could be $150,000. It could be $350,000, and that's going to be a function of either the community that you've selected that you want to go to, and or the size of the apartment. That CCRC monies, provides you a number of things. One, access to the other levels of care, priority access if in case there's a high demand for assisted living or memory care. In some cases, it provides you with financial benefits compared to someone that's coming in from off the street, if you will. In some cases, the CCRC may have a benevolent fund or a life care plan that you've purchased, which essentially means that even though your financial resources have been evaporated and you're no longer able to afford the monthly fees associated with the apartment and or the level of care that you're in, you're going to be allowed to stay there. And that upfront fee in the plan that you purchase typically is associated with a percentage. It could be a 55%, could be 80, could be 90%, which essentially says that at the time of your leaving the community, either you decide to move somewhere else or you unfortunately pass away while living there. That percentage of that upfront buy-in will be either distributed back to you individually or will go to your estate, your beneficiaries. And finally, supportive living, or a SLIF, is a great program. It's unique to the state of Illinois. This is senior housing, residents 65 years and up. It's very similar to independent living with services from the standpoint of as long as the care that somebody needs can be scheduled, and there's some mobility requirements that are associated with it, then you can stay living in supportive living. You get paid privately in supportive living. And the other thing that's the major difference between CCRCs and memory care, assisted living, and independent living is that you can apply for Medicaid and you can stay. And so that is one of the two senior housing options that exists in the state of Illinois, where Medicaid can allow someone to live long-term. Okay, Gina. So how much do things cost? So this graph kind of goes left to right. In-home care, there's some estimates based off of data from the national statistics. I think the easiest thing for me to describe for you is that right now the in-home care on an hourly basis is running about $28 to $30 per hour for hourly rates. For someone to have a home care associate in your home 24/7, the daily rate will be like $330 a day on up. And a home care provider can pretty much do anything that's non-medical. So the ADLs that we talked about before, they can do things like help with bathing and dressing and grooming and assistance in the restroom for toileting needs. They can be companions. They can provide transportation. They can shop, run errands, prepare meals, things of that nature. Those are all very doable under the for in-home care. The middle, community and assisted living, adult daycare, about 6 hours a day. That's going to run you about $1,600 a month. This can be a great option for families to have someone spend the day in an adult day service environment where there's activities and programming and meals provided, and then come home to their primary dwelling at night. Assisted living, here, they've outlined about $4,700 a month. I guess my experience here in the Chicago area, I tell families that your basic assisted living apartment, a studio or a small 1-bedroom with an average amount of care is going to, is probably going to run you about $5,500 a month, paying privately. And then the costs on the right, the nursing home, those are pretty close. You're figuring about $8,000 to $9,000 for a semi-private room, paying privately, and a private room paying privately is going to be more than that, in the $9,000 to $10,000 range. Okay, next. So now you've reached the point where you really want to explore senior housing, okay? And you really want to get a little bit more detailed about, what those options might look like. You may want to rely on an expert in the industry that can help you with that, okay? Someone that's going to understand what your particular needs are from a budget standpoint, from a geographic standpoint. Are you relocating from Florida to come back up here to be near family? Are you staying in this greater Chicago area, but now you want to move from the south suburbs to the western suburbs because that's where family is? Perhaps you want to stay really close to where you're at right now because you want to, maintain your connections to your church or your medical providers. Someone that's an expert in the industry can help understand what your needs are geographically to make sure that you are matched with the right options. The other thing that's really important is, what's your care level like? What are you looking for? Are you looking for independent living? Do you need assisted living right now? Is there a dementia diagnosis in place? And so that's really important to understand. And finally, what are your social needs? What kind of fun activities take place in the communities, and you want to try to align yourself with the activities that match up to the things that you like to do. Because you're really, you're leaving your primary dwelling to go into senior housing to continue living, right? And so you want to try to do as many of the things that you're used to doing in that senior housing environment. So that the totality of all of that, from level of care to geographic preferences to the financial means and the socialization needs, those really all need to be accounted for. And a senior advisor can help match you with the properties that make the most sense based off of what the particulars are of your circumstances. There's no reason to go spending your time going to properties that you can't afford, right? So let's just focus on properties that make the most sense. And that senior expert will help schedule tours. Pre-pandemic, those tours were typically, face-to-face in the buildings. Today, a little bit more virtual, but there are also some tours that are taking place. And that senior advisor, you're going to be overwhelmed on these tours, right? And you're going to be listening to a salesperson, explain all the features and the benefits of that property. And you may forget some of the things that are really important to you. That senior advisor's already spent some time and understand what's important to you. And they're going to make sure that all the right questions are asked and answered. Okay, Gina. So now you've narrowed things down, and maybe you're down to just a couple of properties that you really, really want to strongly consider. So one of the first things that happens is that there's going to be a clinical assessment done. There's going to be some paperwork exchanged, a medical list, and a physician report, and that's really done for a couple of reasons. One, they want to make sure that your needs match the property and what they can do for you to make sure that it's a good fit. Secondly, that assessment translates into a cost. Remember what I talked about assisted living and memory care, that the second bucket of cost is the cost of care. Well, this will really help determine what level or how many points of care that you need, and that gets translated into a monthly fee. In some cases, there's going to be a financial disclosure. Typically, all of your CCRCs are going to ask for a recap of what your financial resources look like. And once you've picked that property, you're going to plan a day to move. They're going to have protocols in place, given the current pandemic environment, to allow family members and your movers to come in and you're going to move your furniture and your personal items into your new apartment. And in many cases now, you know, these protocols are changing because more and more people are being vaccinated, but there's a chance that there may be an initial quarantine required for you. Okay, Gina. One thing that you can be assured of is that senior provider, that senior counselor is going to keep all of your information very confidential. Okay, we are very local. We work one-on-one with the families that we are working with and trying to help. We're the point person. We'll help field the calls. We don't want your information. We would never, you know, shotgun blast your information out to a whole bunch of properties and have you become inundated with a lot of phone calls. And we only share your information with the properties that you want us to share that information. We are HIPAA compliant. And like that last one, you know, I will never share your phone number with any community until you say it is okay to do so. Next. And so, as this picture and this caption says, home is really where your hat is. And I wouldn't look very good in that hat, but you know, maybe Gina would look pretty good.
So now that we know where you're moving, the question is, how do we get you there? So we want to make sure that this is a no stress situation. So there's an organization, the National Association of Senior Move Managers, and you're going to want to make sure that you work with one of these professionals because they go through a process of training, working with older adults, and it's all about downsizing and moving properly. So there's a lot to do, and we want to keep it stress-free from you as much as we possibly can, because there's downsizing, there's space planning, determining what furniture from your current home can go to your new home, the actual move, and then what happens to my stuff and what happens to my home. I'm going to show you two really quick videos. This is at a senior living community, and I want to show you the before, which is basically showing you what an empty space looks like. And then I'm going to show you how it just transforms, and you basically just have to walk right in. And that's what a move manager is going to do for you. So it's a quick little video here. So this is what it looks like when you go to look at the place and you're like, oh, wow, all my stuff's going to fit there. But I will tell you that's not always the case. Oh. And so here's a picture of a furnished, the same room, and it's now been furnished. And this is what a senior move manager will do for you. And you'll have the after immediately. So you'll walk in, everything that you had that was going with you is in place, and you found your new home. And here's what it would look like. So as you can see, it's a really easy process that all these things are in place, down to pictures being hung up on the walls. So that's important. So this is some pictures of, again, I was trying to show you some instances. There's a lot of things that are in your home that also now need to get prepared to basically stage your home and make sure that it's ready for a sale. So the picture on the left, is a client that we worked with, and you'll look at the picture on the right and how quickly we changed it so that it was in a situation that it was prepared so we can sell the home so that we can actually get you to that senior living community. So there's a lot of work involved, cleaning things up, disposing of things, and also just making things presentable, because again, we're trying to make sure that we're showpiecing your home so that it can be sold. So again, I mentioned about a senior move manager. So the things that they're going to help you with is that downsizing, that like I said, things like cleaning things out. Right sizing. Right sizing is when we look at the furniture that you have in your current home, what can actually move with you. And we help you through that process on how we can make the decisions, maybe things that are going with you, or maybe it's purchasing some new items that you have in mind. And we're going to make those decisions before you actually make the move. We don't want to get there and you have too much stuff again. That's definitely not our end result. And just have that relocation planning. So everything from packing and the movings, the logistics of it, organizing everything, getting things set up. It could be furniture procurement as well, things that need to be purchased on your behalf. Things like your estate management. So as we talked about earlier, there might be things that need to be sold, and those are things that can be done that add value to things that you will use that money for your community and where you're going. They can work on picking up services, delivery services, photographing those items, and researching what the best value is. And then lastly, it's about that final step. Once you are moved into your new community, it's then preparing that home to sell, doing any repairs and things that need to be done to the home, working with a certified staging consultant, listing the home, selling the home. And there's lots of different people out there that can help you with those services. Again, we do have people on the NEIPC team that work with seniors all the time. I don't think we mentioned to you earlier that a big part of NEIPC is also we go through a vetted process. So we have background checks, and that's why we want to make sure that you have someone to reach out to. And Sadia will have a list of people that can help you with some of these decisions. At this time, I'm going to turn it back to Stephanie, who's going to close things up for us.
So, we've heard a lot of really important, really excellent information. I know we've thrown a lot of information at you this evening, but what we want you to understand is that you're not alone, that there is a whole support system that is here to provide guidance to you and to help you and your families with the transition. And it's very simple. It's just have a plan. You guys are already ahead of the game because you're here, you're interested in this topic, and you've listened to our experts tonight give you some tips for thinking ahead. But it's really that simple. If you have a plan, then the transition, whatever transition that might be, whether you're staying in your home or whether you're moving to an assisted facility, you're able to weather that storm. You're able to make what could be a very stressful situation a fun and exciting transition to a new chapter in your life. And so we are here to help you. We have a whole host of people that we would love to introduce you to. And so we hope that you will reach out to the three of us, and certainly anyone in our chapter. We're here for you. And so, of course, the wise old sage Phil McGraw says, if you don't have a plan, days turn into weeks, weeks turn into months, months turn into years, and before you know it, you're looking back saying, I should have had a plan. Unfortunately, I do have a lot of clients that reach out to me when life has gotten ahead of them, and it certainly makes it not impossible, but more of a challenge to work around those issues. And so we really encourage you to talk to your loved ones about what your intentions are and what you'd like to do, as so that you can provide that assistance and that guidance so that you can enjoy without stress. Thank you very much.
I'd like to stress that there's an email address on there, Chicagoland@ageandplace.org. And any question you have, we can certainly answer for you. Also give you information on some of the different services that are available through our chapter. I'm just going to do a quick rundown of all the different professional service providers that we have amongst our chapter here. And that's non-medical in-home care, home modifications and design, Medicare specialists, financial advisors, elder law attorneys and care coordinators. We have an audiologist. We have reps from Caption Call. We have mental health professionals, certified senior advisors, long-term care insurance specialists, senior transition relocation move managers. We have architects, senior real estate specialists, and reverse mortgage consultants. So we have a good group of people out there to help you. You know, I don't know if you realize the statistic, but over $3 billion is lost in scams every year with the older adult community. And that's a really big reason why NAIPC is out here to protect the older adults and make sure that you're working with, you know, not only insured people, but reputable people, and making sure that, you know, whoever is going to help you in your journey, whether it's staying or at home or going to a senior living community, we just want to make sure you get there safely. And that's really the whole purpose behind the organization itself. Again, I've given all this information to Sadia, who can share a list of the professionals that are part of our chapter, or feel free just to drop me an email and I'd be happy to answer any questions or put you in touch with the right professionals that you need based on what's happening in your current situation. So again, thank you so much for your time tonight. And Sadia, I'll turn it back to you.
Okay, thank you again.